Welcome to YogiViews, where my guest is yoga itself, through interviewing those who practice it, teach it, sell it, or simply love it. I am Antonio Saucis. The use of yogic principles and methodologies with a therapeutic intention is today known as yoga therapy, and it's gaining increasing popularity. Most importantly, it is becoming an effective option for those that tire of unsuccessful attempts to improve through Western medicine protocols, decide to seek alternative options. Yoga therapy is now scientifically proven to be helpful in preventing and aiding in the recovery from physical and mental ailments. As the spectrum of conditions helped by yoga therapy and yoga therapeutic models grow, what is yoga therapy and who is a yoga therapist is a matter of increasing interest and concern, both in the medical and yogic communities. My guest today is a yoga therapist with several years of experience, both as a professional and in the educational realm. Her name is Robin Gueth. Robin, nice to have you.
Nice to be here, thank you.
Robin is a 38-year veteran of yoga and has been teaching yoga therapy for 20 years. She's a graduate of the American Yoga College, directed by Rama Jyoti Vernon, and is certified in Nischala Devi's Yoga for the Heart. She has studied with Angela Farmer and Victor van Kooten, and her background includes Kripalu yoga, Iyengar yoga, Shiatsu and Thai massage, Feldenkrais, Dharma and Acu-Yoga. She is skilled in working with various types of mental illnesses, respiratory illnesses, and orthopedic issues. Her studio, the Stress Management Center of Marin, is the first in the Bay Area to be awarded accreditation in yoga therapy training from the International Association of Yoga Therapists. Robin, our first question for you. How did your yoga life start? What was your first experience with yoga?
My grandmother was a yogini, and she taught me when I was a little girl how to do lotus pose and how to do all kinds of different asanas. So I first saw yoga when I was 5 or 6 years old.
And so for what you said, you started more on the asana aspects.
You know, I was just doing what my grandmother was doing. So when I was a little girl, I would say my formal introduction to yoga came after that. I was trained as a classical pianist, and when I was about 16, I got into some structural issues with a scoliosis in my neck, 3-day screaming headaches and spasms and pain and tears and those kinds of things. And it was yoga that helped me put an end to the headaches, and yoga that helped me keep all that pain at bay. So that was probably more of an introduction to it than playing with postures as a little girl.
Mm. And when did the spiritual aspects or the other aspects of yoga come into place for you?
You know, I've always found all the aspects of yoga to be intrinsic in the practice. So from the moment I was trying to calm down a screaming headache, I had started myself on a journey of a better understanding of myself and the way my mind worked and the way my body worked and the way I worked in the world at large. So it's always been a full package for me.
Mm. And so in a way, yoga, the mix of yoga and therapy was a given for you because that's somehow how you started.
Yeah, I've never seen it any other way. It was actually more of a surprise for me later to find yoga as a physical exercise, because I didn't know it as that, and I wasn't very good at it that way. I'd only ever done it as a way of keeping my aches and pains at bay and keeping my body feeling good and my breath and my mind clear. It's the only way I'd ever used it. So yeah, so I don't actually know how to differentiate between yoga and therapy. It's always been yoga therapy for me.
Mm-hmm. Interesting. Now, what is for you in this moment, because one of the interesting issues was that for years we spoke about yoga therapy and there was no valid definition of yoga therapy. And then in addition to the fact that yoga chikitsa was already there, and some people say yoga therapy is all yoga chikitsa, and others say Ayurveda is the yoga therapeutic aspect of. So what is a valid definition for you of yoga therapy?
You know, I think In the United States, we needed a way to try and describe that deeper, more holistic approach to yoga. So I believe that yoga therapy is probably so much closer to the way it was originally taught. And the only reason we have that delineation in the US, I think, is because yoga became a very popular physical practice, and we needed a way to kind of describe that more holistic approach. So we came with the term of yoga therapy as a way of differentiating between yoga classes the way you might find them, at the gym.
Now, because I understand you're saying that for you, yoga and therapy are somehow very much related, but my question is, not all yoga teachers can be yoga therapists. Not all yoga therapists are interested in just teaching yoga. So yoga can make us all feel well, but probably you can tell us that there is one aspect of yoga that may be more therapeutic than others, or not?
Sure. I think when you were looking for a definition earlier, I think that the definition that we use for yoga therapy is this concept of taking yogic tools and directing them specifically at some kind of issue or ailment. So as opposed to coming in for a really wonderful general movement class, when you're dealing with a yoga therapist, you are going to be talking about what your specific aches and pains or issues are and how we might be able to apply the tools and practices of yoga to empower someone to progress on their way towards health and wellness. In the case of how to use yoga therapy, or
that was a nice definition, by the way.
Thank you. Or where yoga therapy might be strongest, all I can tell you is the way we use it at the Stress Management Center. So we have found these tools to be particularly useful for people with a lot of anxiety, for athletes, for executives with stiff backs, for a lot of different kinds of mental health issues of various sorts. We have found it to be very powerful as a breathing practice to help people sort of step back and take a moment and find themselves. I would say that's probably the strongest use for us. We do end up at the Stress Management Center with a lot of special populations. That happened mostly by accident. It happened by people asking if they could come and take a class, and it never occurred to me to say no. So I always say yes to everybody. I think yoga's good for everybody, and there should be lots of it, and everybody should be exposed to it. So I said yes to group homes of mentally ill. I said yes to the Brain Injury Network. We actually did a study there. I said yes to Kaiser Permanente. We now offer all the yoga for Kaiser Permanente in a hospital-based study and have recently been invited on the clinical side. So for the first time, we are working on the clinical side with chronic pain up at Kaiser. So we ended up in a lot of specialty populations, and we have found yoga to be extremely effective with people who are hurt, people who have big issues.
Now, in the scope of that holistic approach, do you think that yoga has any, because, for some people, yoga may be useful because it provides the appropriate stretches and contortions that can help the organs perform their functions. Others would say that the most important aspect of yoga is the centering effect. Others would say that the true therapeutic aspect is in the connection, because there is a belief in yoga that the cause of illness is the disconnection, the disintegration.
I would say that yoga means union, right? So it's body, mind, and spirit. And I don't think that they are possible to be separated. I don't think it really matters whether someone is teaching just a physical movement. I think it is such a powerful practice that all three things come into play. And the whole idea is that yoga builds our awareness, and it builds our awareness of ourselves, of our bodies, and our breath, and it also builds our awareness of the way we interface in the world. So I would say that that's the power of yoga, and it has stood the test of time, right? 5,000 to however many thousands of years we think it is old. So that's the way I look at it. I look at it as a balancing.
Yes, and perhaps if I understand correctly, you're saying that it is precisely the integration of all aspects, a little bit different from separating, which is something that the Western medicine model does very well. This is why the Western model is great for diagnosing, because it can really separate. But how does the yoga therapeutic model differ from the...
You know, I think that
or not?
Yeah, I think that all of the Western healthcare providers I know would love to see their patients exercising more and sleeping more and eating better and pacing themselves for stress. But I think that the way that model has grown, we are frequently going to a medical doctor looking for a shortcut back to our wellness. We've gotten so far out of the balance that we're looking for a shortcut back. May be very important to get that shortcut back. When you come to see a yoga therapist, you're expecting to have that conversation about lifestyle and breathing and stretching and eating and what you're doing. So I'm not sure that the therapeutic model is so different. I think everybody's after the same thing, but I think the expectations are different when it looks at the public looking at us.
Now, when you describe the intention of the Western practitioners, the doctors, for well-being, and that I have to say, when I teach in Canada, when I'm teaching in places in Europe, even in South America, where medicine is socialized, free, that is the intention of the doctors. That is the intention. Now, in this system where the doctors and the systems are related to the economic profit of tests and exams and all that, do you think it works in the same way?
You know, my experience, in personal experience, and my experience working together with Kaiser Permanente has been very positive. And I think a lot of the steps that are happening now in the healthcare field have a lot to do with getting better outcomes and people not going back into the hospital after surgeries and people recovering better and not ending up in the emergency room and those kinds of things. And I think that you will see more and more practices like yoga coming into the Western healthcare market because we are able to help with that. We are able to help. We were talking about that earlier with the pre and post surgery aspects of yoga therapy. We are able to help people maybe recover a little bit better, have a little better understanding of what's in front of them from the standpoint of recovery, and be more successful with the kinds of undertakings that they might be forced to do depending on what their health is doing. So I have had positive experiences, and I hope they always are that way.
And do you think that the fact that yoga, as you were saying earlier, is based on the integration of mind, body, and spirit, which is not a word spirit that we use in Western medicine?
I think that every physician has their own approach, and I think finding a physician that you relate to and that you resonate with is crucial. And I think it's the same thing is true with a yoga therapist. You're looking for healthcare providers that resonate with you. And we're very fortunate in Northern California to have some of the finest, and many of them are good yogis. I work with several that are very fine yogis and very connected to spirit when they're working with their clients. So I think it has to do with finding your resonant field, finding your resonant group. You need to trust your healthcare providers. It's very important. So that's one of the things that I also help with from a standpoint of advocacy with some of my clients, to make sure that they have a team around them that they truly trust so that they can relax and know they're being taken care of. Now,
in regards to the model again, because this certainly affects trust. We have an allopathic model for the Western medicine, where there's a symptom or a part of the body that is compromised, and then there are certain prescriptions for that symptom and that part of the body. Many in the yoga therapy field understand that we should, or yoga therapy moves away from that model. In fact, Dr. Ananda Balayogi Bhavanani coined a term that I really love, which is yogopathy, the allopathic use of yoga, which is something that happens as well amongst yoga therapists. That is, you have arthritis in your knee, you do 3 repetitions this way in the knee, you'll be all right. And that's not the model of yoga therapy, or not exactly the model. What do you think about that? How do you see that?
You know, we train yoga therapists, as you said, and we've been very fortunate that we've just reached that new accreditation of yoga therapist training in the Bay Area, and we're thrilled to have that. And from that standpoint of training, I would say that we are always looking at what is happening from the Western healthcare model. We're always talking with our patients about what they've been, how they've been assessed, what their diagnosis is. We don't diagnose, we are yogis, we are not doctors. And we take
Western medicine is fantastic for diagnosis.
Absolutely, and we take that diagnosis and then we start to unfold it. And if you looked at the yogic models, some of the ancient models, the kosha model, you will see it used as a diagnostic tool. This is very, very common in the Vinaya Yoga school, and you will see it used as a diagnostic tool. So I would say that, you know, we are not saying that if you have a sore knee, you should do 5 pigeon poses and a downward dog. We are saying that if you have a sore knee, though, I may be looking at your whole alignment of your body. I want to hear about that car wreck you have. I want to know how you're sleeping. I am going to watch how you're walking. So, you know, it's not so dissimilar from that standpoint. But I think it's, we're able to bring much more to the table than a doctor can in 15 minutes. Because I have a great deal more time and I can hear really how your life is going and what you're doing in your life and get a bigger picture of who you are. When I was a little girl, we had GPs, right? There aren't that many general practitioners anymore. And the GP that delivered me, you know, helped me deliver my daughter. So he knew me very well. He knew a lot about, I think he came to all my piano recitals. So that kind of doctor is the one that knows your family and knows what you eat and where you go and how you do it. That's the kind of medical care that I'm used to, that I'm speaking of. And I think when you look at a yoga therapist, they're also looking also from that holistic approach. Not as a doctor, of course, but at that holistic approach so that they understand a little more of what's going on with someone than simply the arthritis in their knee. Little bigger picture. So yes, we do get to do that.
And in your experience, are some conditions that are better suited to be treated with yoga, or all of them are equally good? Or
I'm going to sound like a Pollyanna, but I've actually never found anything that yoga didn't help. I've never found any ailment that yoga couldn't contribute something positive to. Where we've done some research, we were doing some work with the Brain Injury Network, and we decided to do a little research study on respiratory strength. I think the breath and the control of the breath and the focusing of the breath is a huge tool in yoga, and usually, many times, the first tool for someone to gain some control over that has no understanding of yoga. It's one of the easiest things for them to get a handle of. How are they breathing, and are they breathing evenly, and are they breathing deeply? So we did a respiratory study at the Brain Injury Network on respiratory strength is what we were looking for adults with adult-acquired brain injury. And what we found was that respiratory strength improved in just 30 minutes once a week. But more interesting, we found that sense of well-being went from a score of 40-something to a score of 90-something. So what we were able to scientifically document is that if you breathe in and out, you feel better, which was a funny thing to document. But it was helpful. It was helpful to document it. It's helpful to put that documentation out for the Western healthcare model so they know when to call on us and when is a yoga useful and where can we be helpful. So we've done a lot with respiratory things at the Stress Management Center. And we use respiratory and breathing practices very differently depending on the mental health condition of the people that we're working with. So for instance, when I'm working with some of my clients with schizophrenia, I use a lot of chanting and singing so that I know that they're exhaling nice and long and that I know that they're breathing deeply. With my group of brain injured clients, they can't do that. The trauma has been so dramatic in their lives that they were unable to take a slow breath in. So we did it with little sips and puffs, and we played it around another way to get the mind to let us do what we were trying to accomplish with the body. So we've had a lot of experience using breath and variations of breath with different populations, and we've had really some very good success with that.
Do you just mentioned schizophrenia, and even though interestingly enough, autism and autistic syndromes are so prevailing in this moment. We went from 25 years ago having autism as one definition, and today we have over 16 different syndromes. Do you think that there is a difference between the neurosis and psychosis? Let's say that people who are severely ill, as in psychosis, versus people who are experiencing characterological or personality disorders more related to neurosis. Do you think that there's a differentiation there? What would be, my true question is, what would be the point with schizophrenia?
Of what?
To use yoga with schizophrenia.
Oh.
What is the point?
Oh.
What would be your intention?
Well, I can tell you the story of a woman I've been working with for 10, 15 years now, who was severely schizophrenic and in a group home and on very serious medications, auditory schizophrenia, lots of people shouting in her mind. And the first time I met her, she only looked at the center of my body and paced a lot and wrung her hands all the time and tried to move and stared at me and didn't say anything and wrung her hands. And I thought, you know, it was not going to work. And I thought she certainly would never want to come back. She seemed extremely uncomfortable. But she came back the following week, much to my surprise. And so I asked her, do you remember anything about the last time we met? And I thought maybe she would remember a movement or something. And she said, I remember this. And she started doing alternate nostril breathing. And I thought, okay, there's a way in. So even if the conscious mind is busy doing all kinds of things that are uncomfortable, the subconscious mind was saying, give me that. And so I started there. We started with breathing practices, and that's when I learned that I needed to sing and chant with her because it was very stressful for her to count any kind of breath. She couldn't do that. Very stressful for her to do any kind of regimented practice. But we could do singing, and she stopped smoking, and she started being more open to people, and she started looking everybody in the eye. And now she comes into my office. Now we're 10 years later, of course. But much to my shock, I heard her giving someone directions on where the restroom was in the studio, someone who was a complete stranger to her. Upstairs and to the left, I hear her voice. I almost fell over. So she has come so far that in maybe a year or 2 short years, perhaps, the director of the program called me up and said, we all want what she's having. And they brought the whole group. So now I've been working with the whole group for another 8 or 10 years. And we've found huge strides forward. Huge strides forward. You don't get to dictate, oh, if I do this, they'll do that. If I do this, the mind will do that. But if you offer breath and you offer focus and you offer heart and you have patience, it's amazing how the body and mind will unfold. Very powerful.
Yes, and I have to say that I have recently worked with a DID, a dissociative identity disorder client, who, to my surprise, as you're saying, at some point flipped into one of the altars, into one of the personalities. I thought she was gone, and this was at a retreat, and the next morning, when she showed up, she asked a question
from that time.
From the last day.
See?
And she was on the floor out, and she
was
amazing.
Still there.
So
yeah.
I see what you
It's
mean.
a very powerful practice.
In terms of the physical realm, the physical conditions, do you think that yoga is better for arthritis than for lower back issues, or no?
You know, we have lots of studies, and the first studies were all lower back pain because that's the biggest complaint in the US. I think lower back pain and insomnia are the top 2, I think. I use yoga therapy all day, every day for back pain and sciatica and shoulder issues and car wrecks and all that kind of stuff all day long. So from an orthopedic standpoint, it's very, very effective, very powerful. I'm also the stretching coach for the Marin Catholic football team. And in that regard, that's also not the yoga that you see on the internet that says yoga for football. That's not what I'm doing. I'm doing the yoga of car wrecks, right? The yoga of being jostled a whole bunch of different directions when you weren't expecting it. The yoga of being startled or shocked by being jostled from a direction. And my job is to bring these boys back to baseline as quickly as possible so that they can go out and play another game of football. And what we found, I'm coming up on my 7th season, is that they have fewer injuries overall. The injuries that they have are less severe. They heal faster. And for some reason, we have fewer concussions. And we're not exactly sure why, but we are very interested in finding out. And we've had none of the sort of pars fractures, back issues, pulled hamstring, all of that kind of stuff. We don't have a lot of that anymore. It just doesn't happen. And we have a lot of kids that are starting to come to the studio and starting to stretch out and maintain their own bodies at 16 and 17 or 15 maybe, at earlier and earlier, so that they can get more out of their athletics and stay healthier while they do it. Yeah.
Wonderful. You are also working in the area of forming or preparing yoga therapists, educating
Yes.
yoga therapists. So, on the other hand, it's common as well that a yoga teacher who had a knee injury and recovered from it, all of a sudden has a knee group. And is that a yoga therapist? Who is a yoga therapist?
You know, a yoga therapist, the term itself, I think, is also, again, it's that Western construct, right? Because we did take yoga on in the US and make it very physical. And I think it probably wasn't quite as physical, certainly not as physical in India. I think it may have had a bit more of the other underpinning as well. In the case now, when people are, the market, as you said at the beginning of the show, the healthcare market and the people out there that might be interested in yoga therapy, how do they find a yoga therapist? What is a yoga therapist? And I would say that the main piece that differentiates a yoga teacher from a yoga therapist is that therapeutic eye and a very great depth of training. So when we're looking at yoga therapy, we are asking people to have, we train people about medications, all the top medications, and how they actually work in the body, so that you know when you're working with someone whether you are dealing with an issue that they're having that's actually a side effect of a medication, or if it's something that is physically or structurally going on in the body. We work a great deal with Western healthcare models so that we understand what our clients are talking about and what that diagnosis means. From learning how to translate that summary statement in an MRI so that people can actually understand what's going on with their knee or their back or their shoulder. So we are working with a depth of knowledge. A yoga therapist is going to have a depth of knowledge that isn't required of a standard yoga teacher. That's that difference between a 200 or 500 hour yoga teacher versus an 800 hour yoga therapist. It's a different standard of depth of knowledge, mostly around psychology, Western medicine, and therapeutic aspects and applications of yoga tools.
Yes.
Yeah.
Robin, how can people get in touch with you if they want to?
The Stress Management Center is in Larkspur. We have a website, SMC, like Stress Management Center, Marin, smcmarin.com. Or I think you can put in Robin and Stress Management, and I probably pop up on that social media stuff you were talking about.
Okay. Thank you so much.
Thank you very much.
It's great to have you and to hear your good and encouraging stories and views on yoga therapy. And I would very probably like to have you again at the show and perhaps speak about those other economic aspects of your studio that are also interesting to a lot of our audience.
Thank you very much.
Thank you, Robin. My guest today was Robin Gueth. She is a 38-year veteran of yoga and has been teaching yoga therapy for 20 years. She is a graduate of the American Yoga College directed by Rama Jyoti Vernon and is certified in Nischala Devi's Yoga for the Heart. She has studied with Angela Farmer and Victor van Kooten, and her background includes Kripalu yoga, Iyengar yoga, Shiatsu and Thai massage, Feldenkrais, Dharma and Acu-Yoga. She is skilled in working with various types of mental illnesses, respiratory illnesses, and orthopedic issues. And her studio, the Stress Management Center of Marin, is the first Bay Area studio being awarded accreditation in yoga therapy training from the International Association of Yoga Therapists. I hope you liked our show today. And if you care to let me know, send me an email at antonio@yogiviews.com. I look forward to seeing you the next time.